So you mentioned basically how the company has changed as an organization throughout growth. What about how you compare working at AMP Health versus working in a larger strategy consultancy?
Yeah, it's a very good question. AMP Health is quite unique in its model. It's I think when we think of consultants more in the lines of a McKinsey, a Deloitte, in that line, I think we think about what a lot of people picture is somebody who comes in for a short period of time is really a nice sounding board to come up with a lot of answers quite quickly, but then usually leaves, and the question of sustainability is sometimes left out. I think our model is different in that working with governments can be slow and can be bureaucratic, but it's also so important that that's the mode in which we take, because otherwise, as soon as the technical assistance leaves or the consultant leaves, it's easy for a lot of this to fall flat. So I think what we're looking, in terms of the type of person we're looking for a management partner, it's somebody who is more willing to be there to kind of play the long game. In terms of 2 years is a long time in some ways, but it just scratches the surface in others. So I think definitely somebody who's willing to sort of the softer touches, more incremental change, rather than kind of having the mandate that some larger consultancy firms have. That's definitely a bit of a shift. And again, our priorities are the country team's priorities. So it's not as if somebody at the higher level of the ministry mandates that AMP Health has to work with a team. It's very organic in terms of the desire to work with a team. So I think that sets up a nicer power balance between the MP and the team.